Hello, my dear doctor. I'd like to talk on a very important topic that is Alkaptonuria. Let's talk on them and what is written in a note. Just follow me. Alkaptonuria is a rare autosomal recessive disorder of phenylalanine and tyrosine metabolism caused by lack of the enzyme homogentisic dioxygenase, which results in a buildup of the toxic homogentisic acid. The kidney filter the homogentisic acid and hence black urine, but eventually it accumulates in cartilage and other tissues, circle the cartilage, circle the homogentisic acid. Alkaptonuria is generally a benign and often asymptomatic condition. Possible features include that the pigmented sclera, urine turns black if left exposed to the air, and intervertebral disc calcification may result in back pain and renal stones sometimes. And treatment includes that the high dose vitamin C and dietary restriction of the phenylalanine and tyrosine. Once again, I'd like to read another note here for the alkaptonuria. Alkaptonuria is an inherited and autosomal recessive trait, circle the autosomal recessive. There is a deficiency in the enzyme homogentisic acid oxidase, circle the homogentisic acid oxidase, leading to accumulation of the homogentisic acid in the urine and increased pigmentation called ochronosis, circle the ochronosis, in cartilage and connective tissues, circle the cartilage and connective tissues. Urine becomes dark on standing owing to oxidation and polymerization of homogenistic acid. Freshly voided urine appears normal in color, so these patients don't often report the dark urine. The abnormal pigmentation is found in the ear and sclera as well as the articular cartilage at the surgery. Premature arthritis, predominantly affecting the back and later the larger joints, is the most serious manifestation of this disorder, circle the premature arthritis. Intervertebral disc calcification, circle the calcification, circle the disc. Intervertebral disc is characteristic of alkaptonuria, is seen on the spinal X-ray. The knees are commonly affected. The sacroiliac joints are spared. And calcification of the aorta is often seen on the chest X-ray. A low-protein diet is recommended to reduce the amount of homogentisic acid, and which is a breakdown product of the tyrosine. However, this does not improve or prove very effective. Sometimes we are getting the urine is positive for the glucose sticks by the clinistics test. Homogentisic acid itself is a reducing substance, so sometimes a false positive test that the urine analysis showed that the glucose is double plus. Sometimes you can understand by getting a misinterpretation that glycosuria means a glucosuria. So this is not a glucosuria rather than homogentisic acid is a reducing substance. That's why you are getting the positive in urine. So here's my idea. Causes of false positive clinistics test. Clinistics test false positive is a fructose, pentose, lactose, salicylate, ascorbic acid, and homogentisic acid. So circle the ascorbic acid, circle the homogentisic acid. And other than 2 and salicylate acid, so these 3 acids that we need to remember. And others are fructose, pentose, and lactose other than glucose. So another thing that I would like to add here, homogentisic acid is a reducing substance and therefore gives a positive reaction to glucose sticks. Other substances that produces a false positive glucose sticks test are right as follows, like the fructose, pentose, lactose, salicylic acid, and then ascorbic acid, as well as the homogentisic acid. Glucose oxidase, once again another name, is a Clini test. Glucose oxidase sticks do not give these false positive reactions. So to exclude that the glucose oxidase test can be done, this is called the Clini test rather than the Clini sticks test. This is the glucose oxidase sticks do not give this false positive reaction. So yes, my dear, I would like to talk on the very important disease that we are talking here, that is the alkaptonuria. So let's give a box of boxes of alkaptonuria. That's really helpful. So before going to the alkaptonuria, I'd like to talk on an important talk. There is the SS box once again. If I'm saying the alkaptonuria, the word itself says that the alkaptone in urine, we can say alkaptone in urine. And the name of this disease is the black urine disease. And the name of the disease is the black bone disease. So alkaptonuria, after the that you can remember the black urine disease and black bone disease, does give an idea that urine becomes dark when standing for a long time. Yes, and black bone disease, the bones become black, is also another important part. So what I'm saying that alkaptonuria, the word of the alkaptone, I'm saying this is nothing but an acid. So we can write this is acid urea. And this acid we called that the homogentisic acid. We write then HA. What I'm saying that homogentisic acid. Homogentisic acid. Homogentisic acid in urine. So that is called the homogentisic aciduria, means the alkaptonuria. And I'd like to give another box of, right, before going to the alkaptonuria biochemistry that we need to learn. You'll see an important, the flow chart is given here. So it starts from, just follow me, the flow chart is given that the alkaptonuria reflects the absence of the homogentisic acid oxidase activity, means the enzyme responsible for homogentisic acid in the blood then comes in the urine. There is a homogentisic acid oxidase enzyme deficiency. Just follow me that phenylalanine, then phenylalanine hydroxylase enzyme, with the help of this, it turns into the tyrosine. So phenylalanine and tyrosine you have to remember. And tyrosine transaminase transmits, means the transform the tyrosine turn into the p-hydroxyphenyl pyruvic acid. So PPP we can write p-phenyl pyruvic acid. Once again, with the help of another enzyme, oxidase, means the p-hydroxyphenyl pyruvic acid oxidase, turn into the homogentisic acid 2,5-dihydroxyphenyl acetic acid. So homogentisic acid oxidase enzyme transforms the homogentisic acid to the mallyl acetoacetic acid. That's very important. Mallyl acetic acid turned into the fumaryl acetic acid, turns into the carbon dioxide and water in the citric acid cycle. So this is the normal pathway, right? And in between the homogentisic acid oxidase enzyme deficiency leading to homogentisic acid will be more and more. And this homogentisic acid is a product of, that's really important to remember, there is a tyrosine and phenylalanine. So we can write a box. If you're writing the box, that's really important that we are writing the SS box, that alkaptonuria, I'm writing now. We already learned this is the homogentisic acid urea, all right? So we can write this alkaptonuria is nothing but the homogentisic acid urea. And this homogentisic acid in more and more in the blood then spilling into the kidneys means the urine, so that is leading to, so this is due to the deficiency of homogentisic acid oxidase. The another name of this enzyme of homogentic acid oxidase, that is homogentisate, I am saying 1,2-dihydroxy or dioxygenase. So homogentisate 1,2-dioxygenase, HDO. So this similar name is the deficiency of these enzymes, leading to more and more homogentic acid in the urine. So I'd like to make a box of the Alkaptonuria. What is that? I'm writing a box here. That's this box. I'm writing the Alkaptonuria. I'm starting with the A stands on the acid, my dear, that we need to remember. What does it acid means that we need to remember? Acid means homogentisic acid. And this is due to the homogentisic acid oxidase enzyme deficiency, or another name is an HDO deficiency. Right? I hope that you got it. And these leads to the homogentic acid more and more. All right? In the urine, acid urea, and in the urine. And when it comes onto the ear, means in the urine, that is oxidized, there is homogentisic acid and polymerizes, leading to the dark pigment. Dark pigment. So this dark urine, that's why you called it that the black urine disease. Next point is the very important, my dear, that I'm saying this homogentisic acid, because of the excessive amount in the blood, they are going to the, yes, the articular cartilages and also the connective tissue disorder, connective tissues, as well as in the, once again, in the sclera. Yes. So we can write this alkaptone means the homogenistic acid is going to the different places and deposited in the different parts of the body. Especially we can write that the articular cartilages. So articular cartilage deposition we can write. So articular cartilages depositions of this alkaptone or homogentisic acid, because of this pigment, the dark pigment, deposition, so this is called also ochronosis. And because of this articular cartilage deposition leading to arthritis. I'm writing the arthritis. And these arthritis, we can say this is the premature arthritis, is one of the important serious effects and usually involved in the SI joints, the intervertebral disc, means the intervertebral, means the spine joints. We can write the spine joint involvement, the spine joints. And next, joints with large joints, usually the knee joints involvement. So the spine joints involvement, the patients will come up with the back pain. Yes. One of the important features here, that is the SI joints is spared. Just write down the way, my dear, I'm writing. Next to the alkaptonuria, if I'm taking the K, that will be helpful to remember the K4. Remember, my dear, this is very important, that the K4 cartilage, yes, means the cartilage deposition and also cartilage calcification. And especially the intervertebral disc calcification is a characteristic of this disease. And next is the K4. We can remember K4 once again. I'm writing the K4 connective tissues. And the connective tissues, especially the collagen tissues depositions, and connective tissues are, that is the sclera, means the sclerae, and also the brown pigmentations of the ear. Another important talk that I'd like to write down this important box here of the A group that I'm writing once again. This calcification, and also this can be calcified of the aorta as well as the artery, means the coronary artery disease by calcification. So we can write the calcification. So calcification of the aorta can be seen by chest X-ray, and coronary artery disease can be calcification done by the CT coronary angiogram. So we can learn the calcification, but this is the point for aorta and artery, means the coronary artery disease. So this is the box for the Alkaptonuria. And one of the important P and T I'm taking here, this P4, we learned it, phenylalanine and tyrosine, that we need to remember. Alkaptonuria. So we can write the P and T, that is the phenylalanine and T4, once again the tyrosine. These two are the pre-products of alkaptone or homogentisic acid. So my dear, what I'm saying now, the another box for the investigation, having these pictures all together, right? So you can intervertebral disc calcification, you can do the X-ray spine. So what I'm saying, my dear, this is very important. The investigations of alkaptonuria, the word says that urea, so proved by urine test. So in urine that false positive, glucose stick test can be positive, right? Test, urine test, and urine becomes dark once again because of presence of this, but we need to prove by doing the other test like the X-ray of spine. An X-ray of spine is a characteristic for the alkaptonuria. Make a box, my dear. And next, once again, the alkaptonuria, the box, once again, alkaptonuria. treatment. Once again, A for acid that we need to remember. Acid means the ascorbic acid. We can write the ascorbic acid, means the vitamin C. So must remember. And also the diet restrictions of containing phenylalanine and tyrosine. So we can write the diet restrictions to the PT restrictions. So my dear, I'd like to talk on further regarding the alkaptonuria and the SS boxes that I provided here. This is very important. So somebody talked that alkaptonuria is nothing but A for acid, remember. So I'm saying once again A for alkaptonuria, A for acid. And last talk once again A for alkaptonuria, A for acid is a treatment. Yes. So once again alkaptone is an acid, means the homogentisic acid. And then the name is the black urine disease and black bone disease all together. Next point, the alkaptonuria is an homogentisic acid in the urine. This is due to nothing but the homogentisic acid oxidase enzyme deficiency or homogentisate 2,1,2-dioxygenase enzyme. The same enzyme, the HAO. And the pre-products of the homogentisic acid, we have the P and T alkaptone. So we have the P and T so that we can remember the phenylalanine and T for tyrosine proteins or amino acids. All right. So next point is that in the box alkaptone. I'm trying the A for acid that I'm homogeneous acid deficiency leading to the urine dark. Next one is A for arthritis. The most important points that A for articular cartilage pigmentation, that is called that ochronosis because this homogentisic acid deposition. So I'm saying the chronosis also can be helpful. And once again the A for arthritis, that is premature arthritis. Especially the spine joints is involved first, next the knee joint. And most important points here you see there is the SI joints is typically spared. So it's very important having a back pain, maybe the young adult, the persons come up, the young adult, the persons come up with the back pain, usually a bit of rheumatism is there, means the morning stiffness. So what we are saying, a single SS box will be helpful here, that the young person, young adult with the back pain, always we think about ankylosing spondylitis is the #1 diagnosis. But once again, the second diagnosis here, we can think that is alkaptonuria. So both 2A, this is very important to think about. So the differentiating points in ankylosing spondylitis, the first joint is involved, there is the SI joints. In contrast, the alkaptonuria, the SI joints is not affected. It's very important, and to see the X-ray is very important, my dear. So what I'm saying that I'm writing once again having a back pain, typical back pain of the young adult. So we will do an X-ray spine. In X-ray spine, that we see that SI joint involvement, diagnosis ankylosing spondylitis. In contrast, SI joints is not involved, diagnosis once again Alkaptonuria. So whenever we'll have the X-ray in your exams, my dear, the X-ray film will be there. Yes, the film will show the ankylosing and the ankylosing once again, but the SI joints is typically spared. Ankylosing spondylitis is less likely, but more likely the alkaptonuria. Along with that, the most important part, then SI in the spine joint, we will see that the intervertebral disc calcification. But in both cases, the ankylosing will be present. Ankylosing will be present. So the differentiating point is the intervertebral disc calcification in case of alkaptonuria, but here is the SI joint involvement in case of ankylosing spondylitis. I hope that, my dear, this box will have the tremendous effects, right, to differentiate in between these two, and we must go through them. And along with that, right, you see the very important talk that we are talking here. There is the K for cartilage and K for calcification, cartilage, calcification, and these are intervertebral disc calcification, the characteristic, and also the connective tissues, K for connective tissues, K for collagen, especially the sclera, pigmentation, and ER pigmentation. So having a photograph, that is the sclera pigmented and the ER, all right, having a brown pigmentation in the ER, once again the cartilage, once again the sclera is the connective tissue, cartilage, connective tissue, intervertebral disc calcification, CCC, I said. Here's the cartilage, then the connective tissue means the sclera, and the intervertebral disc calcification, this 3C once again you can, that is the diagnosis of alkaptonuria. So yes, my dear, this is the alkaptonuria. Along with that, we learned calcification, also the aorta can be seen on chest X-ray, and artery calcification in CT coronary angiogram, also the coronary artery disease leading to can be possible in alkaptonuria. So the diagnostic test for the alkaptonuria, you see the alkaptone in urine. Yes, the urine false positive test, but the X-ray spine will be the diagnostic. And once again, the treatment of alkaptonuria is an acid, means the ascorbic acid, and also the dietary restriction of the protein containing the P for phenylalanine and T for tyrosine containing diet. That is helpful. So remember, my dear, once again, I'd love to start the single talk of the alkaptonuria. A for alkaptonuria, A for acid, my dear. Second box, once again, the alkaptone, P and T. P and T is the phenylalanine and T for tyrosine, the pre-product. And the enzyme A for acid, yes, a homogentisic acid oxidase enzyme deficiency, leading to more and more homogentisic acid that comes onto the urine, that called the dark urine, standing on the dark urine. So that's why you call it the dark or black urine disease. And this is the dark pigmentation, all right, that deposited into the different tissues, means the connective tissues also can be characteristic, all right. So yes, I'd like to give an examples, right. There is a external signs of the pigment deposition called ochronosis begin to appear. So yes, in the cartilage, as I said, that upon microscopic examination, the amber-colored oval-shaped structures, yes, are detected in the mid to upper dermal tissues. And this is the photography that you can see the dark pigmentation. So the other photography that you have seen, the intervertebral disc Yes, the calcification, intervertebral discalcification, having the sclera pigmentation, yes, having once again the pigmented cartilage means in the ER, PINA, so in that case that you can make your diagnosis clinically, there is alkaptonuria. So yes, I'd like to talk on further talk. Yes, number 3 box here. There is a single talk here that we need to remember. There is the articular cartilage pigmentation, there is ochronosis that is seen usually during surgery. So this is called ochronosis. And then arthritis, the premature arthritis, so the patient will come with back pain. Yes, and the knee joints also can be affected. SI joints is typically spared, and we learned it, the differentiation points from the ankylosing spondylitis and cartilage calcification and connective tissue, yes, once is sclera and ER. So once again, the sclera, ER, intervertebral discalcification, and having a pigmentation diagnosis done. That is, and another talk here, that is the aorta and artery also can be affected. So somebody talk about alkaptonuria is an A and K, that we put the A and K from here. Fourth box here, the differentiating points of the ankylosing. Ankylosing is present in both cases, but the intervertebral discalcification is for alkaptonuria, and SI joints involvement is ankylosing spondylitis, which is not involved in alkaptonuria. 5 important box in a 5 box, yes, once again, there is alkaptonuria diagnostic test. Urine can be the false positive, but the X-ray spine is the intervertebral disc calcification. Yes, these are the characteristic pictures here. And the treatment is once again alkaptonuria is an A for acid, A for ascorbic acid is the vitamin C, and the diet containing the PT, alkaptone, PT, P for phenylalanine, and tyrosine containing diet restriction will be helpful. My dear, yes, the summary talk. 1. Alkaptonuria, A for acid, homogentisic acid, how homogentisic acid oxidase enzyme deficiency, alkaptone, P for phenylalanine, tyrosine. Third was alkaptone, A for arthritis, A for articular cartilage, and cartilage once again, and also the calcification as well as the connective tissue, KK, and A for aorta, A for artery, and the differentiating points are ankylosing present in both cases, but having SI joints, ankylosing spondylitis, yes, SI joints spared, but intervertebral discalcification. Next, alkaptonuria, urine test positive, false positive, and A for acid is the treatment of choice. So somebody talk intervertebral discalcification, having a photo of intervertebral discalcification without involving the SI joints and the sclera pigmentation as well as the ER calcification and also the brown pigmentation. This is the diagnosis of alkaptonuria. The treatment, A for acid, A for ascorbic acid. I hope that my dear you enjoyed the alkaptonuria. Thank you very much.